Hi, my name is Tate Johnson, and this is going to be my peripheral IV access video. So I'm going to go ahead and walk on in. I check the orders to verify the need for the PIV insertion. I'm going to go ahead and do my hand hygiene. And I've gathered my supplies that are on my table there. And go ahead and walk on in. Hi, my name is Tate. I'll be your student nurse today. Could you tell me your name and date of birth? Okay. And I'm just going to verify it with their wristband. It matches. We're all good there. Now, do you have any allergies to any adhesives or chlorhexidine, alcohol preps, latex? No? You're okay? All right. And are you in any pain right now? No pain? Okay. Well, if they were in pain, we would make sure that we can give them the pain meds before we continue. And I've also looked into any reason for local anesthetic, and I would apply that now if it was necessary, but we won't need to be doing that today. So, I'm just going to go ahead and just visually inspect the arm, see if there is any clear dirt or anything on there. It looks pretty good. So if it was dirty though, I would clean it with soap and water. And yeah, since that looks good, I'm gonna go ahead and move that up to a working position, make sure my patient is in a low Fowler position. Okay. Go ahead and apply gloves. Be careful to not contaminate my tips. Go ahead and connect that. And I'm just going to go ahead and run some saline through here and saline mock it. Got that clamped. That there. And just before I forget, I got my needle. Go ahead and open up my kit here. Make sure I've got everything in order. Got our tourniquet, tape, tourniquet, we have our tegaderm, as well as our CHG. Okay, so once again, I'm just going to make sure I have a good vein here. Looks like this would be a pretty promising one here. I'm going to go ahead and apply my tourniquet. And this time I'm also going to ensure that my patient's arm is below their heart level. Okay, got that tourniquet. Can you have you just squeeze your arm a few times? Okay, so yep, looks good there. And I'm just, before I get too carried away, I'm just gonna get my tape set up. just gonna read the light before I start doing the cleansing, so I'm gonna throw those away. Hand hygiene. Now I'm going to cleanse the site with CHG. Alright. So, going to take my CHG and crush this, and then I'm going to go about where I want my site to be, about 2 to 3 inches below the tourniquet. I'm going to start in the middle and go in a circular motion. I'm going to move outwards away from the site. Okay, and then throw that away. And then I'm gonna make sure not to pat it dry, not to blow on it, not to fan it, just let it air dry for about a minute or so there. I'm gonna get my needle ready. Since enough time has passed, right now I'm going to get my needle ready. I'm going to make sure that I'm not touching the site that I intend to poke, but just below it I'm going to take my non-dominant hand, pull it taut. I'm going to go ahead and insert at 15 to 10 degree angle. I feel it give. Jar flat, and then without advancing the needle further, I'm just gonna keep pushing this until the tip is touching the skin, like so. And I'm getting a blood flashback, so I'm just gonna go ahead and pinch right there to stop any blood flow. Oh boy. Remove my needle, withdraw the cap. Sticking this without contaminating that. Yep. Oh. Go ahead and connect this. Hold my pressure, and then I'm going to release my tourniquet. Like so. And get my flashback, and then I'm going to go ahead and flush. Doing okay? Yeah. Ready, holding pressure, and clamp this. Now I'm going to go ahead and apply my Tegaderm. Okay. Now I'm going to apply my tape. We'll go underneath. Cross over. Cross that over. I'm just going to move my clamp here. And then take our last piece of tape here. Oops. Secure it here. And then we're also going to secure this guy. Okay, and then I'm also going to go ahead and grab my label. I'd write down the date, gauge we used, date and time, the gauge that was used. Where's my little thing? But I have one over here. Anyways. And I would initial it. And then, just one last thing I'm gonna do before I go. Make sure that's clamped, everything looks good. I'm just gonna take my hub here and I'm gonna scrub this for 30 seconds. Okay, so now I'm just going to clean up all my things, make sure my patient is comfortable, bed is in lowest position, and make sure they have their call light, and see if they need anything else.